There's a Japanese proverb translated by the American poet Edward Rowland Sill. At the punch bowl's brink, let the thirsty think, what they say in Japan. First the man takes a drink, then the drink takes a drink, then the drink takes the man. This is from the website High Gravity, the drink that takes a drink. It's an astute description of how addiction develops, despite the lack of scientific understanding. It was written almost 200 years ago. Yet it doesn't reflect the harsh judgment and mistreatment of alcoholics and addicts that was common during that period. As an addictions counselor of 13 years and a nursing student on the verge of graduating, I'm very aware of how our scientific community has come a long way in its understanding and treatment of addictions. And yet in our general community, our continued misconceptions and the stigma are still too widespread today. Until we accept the advances into scientific research that clearly recognize addiction as a chronic brain disease that, like many other chronic diseases, requires comprehensive, long-term treatment, we cannot begin to manage the alcohol and drug use problems in our society successfully. Today, I will discuss addiction as a chronic brain disease, how it's comparable to other chronic diseases, and how our letting go of the stigma of addiction will greatly help those afflicted with this disorder. From their research article, Drugs, Brains, and Behavior, the National Institute of Drug Abuse defines addiction as a chronic relapsing brain disease that's characterized by compulsive drug seeking and use despite harmful consequences. Common misconceptions include that it's a lifestyle choice, but a logical, rational mind does not choose to repeat something that causes so much suffering. People lose their families, their health, their very sense of self. No one chooses that. Another misconception, that addiction reflects a lack of willpower, or worse, a moral or spiritual weakness. But not only does criminalizing or demonizing addiction exacerbate the problem, it doesn't even come close to explaining its nature. Addiction is referred to as a brain disease because it changes the brain structurally. Advanced imaging studies, such as a functional MRI or a PET scan, clearly demonstrate biological and neurological alterations. The disease is characterized as chronic because, unlike an acute disease, such as a respiratory infection, one cannot simply receive a limited treatment and be cured. Chronic diseases must be managed with long-term treatment, quite frequently for a lifetime. So how substance use can develop into a disorder has to do with how alcohol and other drugs can alter brain functioning. You can find more information about this on the National Institute of Drug Abuse website. Naturally, our brains release feel-good chemicals, neurotransmitters such as dopamine, which cause us to feel pleasure. The release of these neurotransmitters are part of what we refer to as the reward system, essential to learning and repeating necessary behaviors. From satisfying physical needs, such as quenching one's thirst or easing one's hunger, to satisfying an emotional need through intimacy, we are rewarded for those behaviors that support our well-being and our continued existence. Now, all mind-altering drugs, regardless of the different stimulating or depressing or distorted thought processing effects, in other words, whether it's methamphetamine, alcohol, or a narcotic pain medication or marijuana. Regardless, they all tap into the brain's reward system. What happens with continued use is due to how these substances affect and eventually alter the brain's neurobiological functioning, even when one is not using. With use, the reward is a sense of euphoria, which is much more intense than what the brain produces normally. Because the brain's reward system and learning system are connected, with enough repeated use, the brain eventually prioritizes the now perceived life-sustaining activity of getting drunk and high, at which point using is no longer a choice, but an intense, irresistible urge, a compulsion. Some people struggle with seeing addiction as a disease, despite the scientific evidence, perhaps because of the behavioral component. But it's comparable to other diseases. It's diagnosable. Medically referred to as a substance use disorder, it's diagnosed using the clinical guidelines found in the Diagnostic and Statistical Manual of Mental Disorders, the most current, the DSM-5, published by the American Psychiatric Association. It's also used to define schizophrenia, autism, and neurocognitive disorders related to such things as Parkinson's, a traumatic brain injury, or a stroke, all diagnosed as brain disorders, but none which carry the same stigma as addiction. How physiology is altered as a result of the disease can be seen in imaging studies. In this first set of scans from the Incognitive website, these are images of the brain with cocaine addiction, alcoholism, and obesity as compared to normal brain scans. What you're seeing is a decreased brain activity in addiction with withdrawal, which causes the intense drive to use. And again, it can be seen not only with alcohol and drug addiction, but with other behaviors that become compulsions, such as eating. In the second set of scans, found at the website Shatterproof, The Science of Addiction, for comparison, to demonstrate addiction as an organ disease, what you're looking at are scans of decreased brain activity and brain disease as compared to normal brain functioning, and the decreased cardiac activity and heart disease as compared to the functioning of a normal, healthy heart. Now, the major at-risk factors for requiring addiction are the same for many other chronic diseases: genetics and lifestyle. To quote from the National Institute of Drug Abuse, scientists estimate that genetic factors account for between 40 to 60% of a person's vulnerability to addiction. A genetic predisposition does not mean one's destined to develop a certain disease, but that one is more likely to do so. It is in combination with other risk factors that the disease manifests itself. Lifestyle is the other major risk factor, being a major contributor to the development of many chronic diseases. It includes what and how much one consumes, and whether or not there are other activities. In the case of alcohol consumption, for example, the greater the quantity and frequency, obviously the greater the risk for addiction. But equally important is whether the person is involved in other unrelated activities. A person whose only emotional, social, and recreational outlet is drinking is at a much, much higher risk. There's a certain parallel with so many other chronic diseases, such as heart disease and diabetes type 2. Again, what and how much one consumes. In these cases, considering, for example, saturated fats or carbohydrates or overall calories, and whether or not there are other activities. A sedentary lifestyle is a huge contributor to developing these diseases. So let me go over how letting go of the stigma will help. We cannot shame, humiliate, or punish a person into recovery. It's true, there are many unacceptable, sometimes criminal behaviors that come out with addiction that of course must be addressed accordingly. But we need to accept that many of these behaviors are a product of the disease. We must address and treat the disease. Understanding and accepting addiction as a disease will refocus our efforts and help us to become more effective with our treatments, which need to be long-term and comprehensive to help with the multiple challenges one faces with a chronic disease. Without the stigma, people are likely to accept their problem and seek treatment and do so in an earlier stage in the disease. Societal agencies, from legislation to insurance companies to treatment providers, are more likely to make available the services needed and in a more therapeutic environment where healing and recovery can take place. With more acceptance and support, people are much more likely to maintain a long-term recovery. With the advances in scientific research, the misconceptions and mistreatment of addiction should not still exist today. It is imperative that we as a society let go of our fears and superstitions and uninformed beliefs, and that we fully support the medical community's recommendations in treating this disease. Today I've discussed addiction as a chronic brain disease, how it's comparable to other chronic diseases, and how our letting go of the stigma of addiction will greatly help those afflicted with this disorder.